Hi sturdy women, hi sturdy friends. I hope you're having a good week. I hope you're feeling good in your body. Today I want to talk about finding a doctor who can diagnose lipedema and help you manage your symptoms, something that has traditionally been a long and difficult process. I know that sounds really bad, but I want to emphasize that there is hope. Today, I'm sharing 4 resources and tips to give you a head start and hopefully significantly reduce that timeline. The Lipedema Foundation is an amazing resource for patients regardless of where you are in your journey. Within the past year, they launched a directory of diagnosing clinicians and therapists that includes more than 300 providers in the United States. It's really growing rapidly, so check back regularly even if you don't see anyone in your area listed yet. Now, if you already have a great doctor or therapist, help out the community by asking them to join the registry. You can also recommend your provider directly to the Lipedema Foundation, and someone will reach out to your provider's office to confirm whether they want to participate. All the information for doing that is on the Lipedema Foundation website. In addition to the provider registry, the Lipedema Foundation has amazing resources to help you prepare for your appointment, advocate for yourself, and find a provider even if you don't see one listed in their registry. Their website includes a list of other directories to check, including Close Training and the Vader School, which both train lymphedema therapists. All of these resources are gathered in a resource guide that I'm linking for you below this video. I also want to note that the main reason you may want a formal diagnosis is if you plan to have surgery like liposuction and want to have that covered by insurance, or if you are trying to get a pneumatic pump. At least in the United States, the high quality pneumatic pumps are considered durable medical equipment and are only available with a prescription through a medical provider. Not to be confused with the Lipedema Foundation, the Lipedema Project also maintains a database of providers, but there are a few key differences. First, the Lipedema Project directory is global, so if you're looking for someone outside the United States, this will be a more helpful resource for you. Second, the data in this database is submitted by patients. That means a provider might not know they're listed. I've heard of patients calling providers that they saw in this directory and having a negative experience, so I just want you to know that. And remember, you can also start doing a lot on your own while you continue working towards that formal diagnosis. My Conservative Treatments playlist outlines a lot of the things that have helped me on my journey and may give you some ideas of things to try. I'll link that in the resource guide below. There are tons of lipedema groups on Facebook. Use them to connect with others in your area and get provider recommendations. Post in large groups like Lipedema Sisters or Lipedema Warriors and ask for help. Also look for geographical groups or special interest groups that may apply to you. Finding these may require a little bit more digging just because of how people name them, but I'll include some examples in the resource sheet for this video. Let me know if I missed one that you're in, and I'm happy to add it to my list. My one caution about social media is to use it for what serves you and let go of what doesn't. I learned a lot from other people's social media posts at the beginning of my journey, but I also found some of it frightening and depressing. Remember, you control what you see in your social media feeds, and your thoughts will reflect what you expose them to. And if you can't find a doctor in any of these other places, just find a kind and sympathetic doctor with an open mind. There are several great resources designed specifically to educate doctors about lipedema and help them learn how to diagnose you. The first is the Lipedema Foundation's Clinician's Guide to Lipedema. You can download this from their website or request that they send you some printed copies for free. It includes things like commonly used medical codes, diagnostic information, and QR codes where they can get more information. The Clinician's Guide is a great resource to use with the brochures. If you haven't seen these yet, you can download them in multiple languages from the Lipedema Foundation website. You can also request that they send you printed copies for free. It includes basic information about lipedema, and it's appropriate for both patients and doctors. You can find the links for both of these in the resource guide. Another resource you may want to share with a medical provider is the book, Lipedema, the Disease They Call Fat, an Overview for Clinicians. It's designed to walk a provider through the steps of diagnosing lipedema and includes a lot of helpful background. The paperback book costs about $30 on Amazon, but makes a great gift for your doctor. I always keep a few on hand, especially for Lipedema Awareness Month in June. The resource guide for this video includes links to everything I talked about today. It's linked below, so be sure to check it out. And if I missed anything or you have other suggestions of ways to find a doctor, please contribute your experience below in the comments. If this video was helpful, please like and share so that we can reach more patients and give them hope and help on their journey. For more about me and my journey with lipedema, lymphedema, and venous insufficiency, head over to sturdywoman.com. I'd love to see you there. Mwah! I'll see you next time.